Middle East Respiratory Syndrome, MERS, caused by the MERS coronavirus, MERS-CoV, first emerged in 2012 in Saudi Arabia. This zoonotic virus is transmitted from animals to humans, with studies indicating that camels are a significant reservoir host for the virus, serving as a primary animal source of MERS infection in humans. While the exact route of transmission from animals to humans remains unclear, direct or indirect contact with infected dromedary camels has been implicated. Transmission of MERS-CoV among humans primarily occurs through close contact with an infected individual. The virus can spread when an infected person coughs or sneezes, releasing droplets containing the virus into the air, which can then be inhaled by others nearby. This mode of transmission is particularly effective in healthcare settings where the concentration of vulnerable individuals in close quarters often results in hospital-associated outbreaks. The severity and extensive nature of the infections during the 2012 outbreak can largely be attributed to the novelty of the virus. The population had no pre-existing immunity to MERS-CoV, rendering everyone susceptible. Additionally, the initial lack of awareness about the virus and its transmission dynamics contributed to delayed response measures, further complicating containment efforts. In healthcare environments, the virus demonstrated a strong ability to spread, exacerbated by initially inadequate infection control practices. This led to higher transmission rates among healthcare workers and hospitalized patients. Since then, efforts to control the spread of MERS have focused on improving surveillance, strengthening infection prevention measures in healthcare settings, and boosting public awareness about the risks and prevention strategies associated with the virus. Middle East Respiratory Syndrome, MERS, first identified in 2012 in Saudi Arabia, is caused by the MERS coronavirus, MERS-CoV. The outbreak has significantly impacted health, society, and economies, particularly in the Arabian Peninsula, with repercussions felt globally due to international travel. MERS has exhibited a high mortality rate, approximately 35% according to the World Health Organization, with over 2,500 confirmed cases affecting 27 countries primarily centered in Saudi Arabia. The virus predominantly compromises the respiratory system, but severe cases can lead to pneumonia and kidney failure. Efforts to manage the spread of MERS have centered on public health awareness. Authorities have been proactive in educating the public about the symptoms of MERS and the critical nature of prompt medical consultation. Campaigns emphasize strict hygiene practices, such as frequent hand-washing and the use of sanitizers, especially after contact with camels or visiting environments where the virus may be present. In healthcare settings, where MERS has demonstrated potential for rapid spread, enhanced infection control protocols have been established. These include the diligent use of personal protective equipment, PPE, the application of rigorous triage procedures, and specialized training for healthcare workers to handle suspected cases securely. Travel-related precautions have also been implemented, with increased screening at airports and points of entry, particularly for arrivals from regions known to harbor MERS cases. Quarantine protocols for suspected cases help curb the spread. Considering the zoonotic transmission of MERS, particularly from camels, public guidelines on the interaction with camels and the consumption of camel products have been instituted. Recommendations include thoroughly cooking camel meat and avoiding raw camel milk. Research and surveillance continue to play a vital role in combating MERS. Ongoing studies aim to deepen understanding of the virus, develop effective treatments, and explore potential vaccines. Robust surveillance systems contribute to the early detection of cases and facilitate a swift response to potential outbreaks. Middle East Respiratory Syndrome, MERS, caused by the MERS coronavirus, MERS-CoV, continues to pose a health concern primarily in the Middle East, with sporadic cases reported globally. Since its identification in 2012, there have been over 2,600 confirmed cases in 27 countries, resulting in approximately 945 deaths. The virus primarily affects older individuals or those with weakened immune systems or underlying health conditions, with a significant mortality rate. To prevent MERS, key measures include enhancing public awareness about the disease, improving hygiene practices especially after contact with camels, and reinforcing infection control in healthcare settings. Vaccination efforts are also underway, with ongoing clinical trials such as those conducted by the University of Oxford aiming to develop a vaccine using the ChAdOx1 platform, which has shown promise in generating strong immune responses in early trials. The prevention strategies against MERS focus on avoiding contact with camels, wearing protective gear when handling camels or camel products, and strict adherence to hygiene practices in both community and healthcare settings. Enhanced surveillance and quick response to any new cases are critical to contain outbreaks promptly.